My name's Andy Tyso. I'm a dementia nurse specialist. I work at the Countess of Chester Hospital, but I also work for Cheshire West and Chester Council 2 days a week to enable and inspire dementia-friendly and dementia-inclusive communities. The group started a few months ago. It's for people who are affected by quite a rare form of dementia called posterior cortical atrophy. Because when somebody gets a diagnosis of dementia, somebody else gets a diagnosis too, and that's the diagnosis of carer. And that carer needs full support, because if anything happens to the carer, something then inadvertently happens to the person with dementia. So we must make sure carers are supported, as well as the person with dementia, by providing activities, by providing peer support, by getting people out and about and included and feel wanted again. This is our third group meeting. What we try to do is, instead of just meet behind closed doors, is to actually get out and about. One of the guys who's on the train today, his dad used to drive steam trains, and he's always had that as a bit of a hobby. So why not relive those moments? I can remember the first time he started to tell me about when he used to go down to meet his dad, and the steam and the smells of everything, which is absolutely brilliant. We get all sorts of emails about oil cameras dirty. We don't get any emails about that. No.
My name is Allison Bulma, and I care for my husband, who is 57 and was diagnosed with PCA at the age of 53. The Northwest PCA support group is an absolute lifeline as far as I'm concerned, because it has there's two angles to it. It gives me companionship and support within a group of people who understand exactly what we're all going through. We can have a bit of a moan and a vent, but it also gives my husband interaction with other people. Just a minimal conversation, even for him, is really, really important. As a carer, I'm dealing with his PCA symptoms and his depression, and I'm watching my partner, my life partner, disappearing, and it's very, very hard on all fronts.
Alistair Burns is my name, and I'm your National Clinical Director for Dementia in NHS England. We know that supporting the carers of people with dementia is absolutely crucial, and that's why when we're looking at diagnosis, we emphasise that post-diagnostic support. And we've just seen a fantastic example of where people with dementia and their carers can go out, can enjoy things, and the adage that we have that goes right back to the National Dementia Strategy a number of years ago, that you can live well with dementia. And that's a great example that we've just seen. Carers can be supported in a variety of ways. And I think for me, one of the important things is John's campaign. So for the carers and families of people with dementia to go and support them through what can be a very traumatic time. Being admitted to hospital is for me very, very important. So that support is a crucial part of the wellbeing pathway.
I'm Julia Jones. I'm the co-founder of John's campaign with my friend Nikki Gerard, and it's actually extremely appropriate and good that we're at Broomfield Hospital today, because I think it was about 2 years ago that Nikki and I had the idea for John's campaign in the summer of 2014, when Nikki's father, Dr. John Gerard, had been in hospital. He'd not had a good experience. It wasn't this hospital, I hasten to say. It was a hospital many, many miles away. Could have happened, though, anywhere, because he was suffering from dementia, or living well with dementia, in fact, before he went into hospital. But the 4 or 5 weeks in hospital without the visiting and the support of his family had reduced him to a state of somebody requiring 24-hour care. He went into hospital able to, enjoy a garden like this, potter around, cook a meal, play a game, read a book, and he came out completely immobile, unable to speak, incontinent. It should be as automatic as if a sick child is admitted to hospital, if a vulnerable adult, an elderly adult, or adult of any age with dementia or any other impairment that makes them dependent in their outside life, that support should be facilitated within hospital.
Hello, my name's Fran Hobby, and I'm one of the dementia specialists at Essex Hospital Trust. We recognised that we needed to introduce more close working with carers, and we looked at introducing open visiting for carers of people with dementia. That's been really important to improving the well-being of people with dementia whilst they're in hospital. When working in partnership with the carers, they were able to support with things like meal times, you know, supporting us to know how to look after the person with dementia. So when we heard about the Johns campaign, we were really keen to sign up to it because it was something that absolutely echoed the ethos that we have at Broomfield Hospital.
For the last 5 years, I've been the carers liaison worker at Broomfield Hospital in Chelmsford. And during that time, it's been my privilege to see some amazing changes happen within the hospital environment. The changes around open visiting for people caring for those living with a dementia have been absolutely fantastic. Clearly, from the point of view of the carers, it's massively reassuring to be able to come in and to make sure your loved one is eating what they want to eat, when they want to eat, that they're having all that social interaction that they're probably used to at home. And from the point of view of the staff, then they learn about the routines that will actually encourage that patient to get better quicker, because they can be partners in care with the carers who are so experienced in looking after that particular individual.